Good morning, everyone. My name is Monique Gignac. I'm one of the scientists at the Institute for Work and Health. Welcome to the IWH Speaker Series. Thank you for joining us. I'm delighted that we have Dr. Kathleen Dobson as a speaker today. Before I introduce her, let me go through just a little bit of some of the housekeeping that we have here. So the first thing I'll let you know is if you would like to access the closed captioning, you can find it at the bottom of your screen. Click on the More button and it should be there and you can turn it on and off. Also, to let you know, we will have the slides and the recording of the presentation made available to people, so you don't have to frantically take notes if you don't want to. This will be something that's available in a few days, maybe about a week, and people will be notified that it is available. Please do subscribe to IWH Alerts to learn more about our speaker series in the future. Today, we would love to have you participate by asking questions, making comments. So to do that, at the end of the presentation, we'll hold questions until then. And we ask that you use the Q&A, the box at the bottom of the screen, and type in your question. We often get quite a few questions, so we'll do our best to answer as many questions as we can. Please don't let that stop you from asking a question. You're also welcome to reach out to Kathleen at the end of the presentation, and her email will be available to you. And Kathleen will get a copy of questions and comments as well, so you can leave those in the Q&A. Sometimes a number of the questions are very similar to one another, so I will try to group questions if we are getting more than one person asking. So again, please do participate. The Q&A box at the bottom of the screen can be used for your question. But let me now turn to Kathleen and her talk today. Dr. Kathleen Dobson is an associate scientist at the Institute for Work and Health, and she's also a professor at the Dalla Lana School of Public Health at the University of Toronto. Her research aims to understand how Canadians who experience mental illness and mental health challenges participate in the labor force. She also does research that explores the long-term health and employment experiences of injured workers. But today she's going to focus on her work with mental health. Her talk is titled Beyond Employment Rates, the Long-Term Work Experiences of Canadians with Mental Health Conditions. Over to you, Kathleen.
Wonderful. Thank you so much, Monique. And I'd like to say good morning, maybe good afternoon, depending on where you're tuning in from. Thank you so much for tuning in to our first speaker series of the season. I'm really excited to be talking about a study that we're just wrapping up, again, looking at the long-term work experiences of Canadians with mental health conditions. So although I'm the one presenting today, I didn't do this study alone. It was funded by the Canadian Institutes for Health Research. We had a wonderful analyst, investigative team, and stakeholder advisory committee guiding us along the way. So I'm really excited to talk about the work that we've done. Now, before getting into the presentation, I just want to have two terminology notes. The first is you'll hear me say the words mental illness, mental health condition, occasionally mental disorder. When I say one of those words, think of them as synonyms. And in about 30 seconds, I'll define what I mean by that. The second terminology is you'll hear me say this word trajectory. All a trajectory is a pattern that occurs over time. So if you think, or when I say the word trajectory, just think about a pattern. So with that, I'd like to introduce why we did this study and what was the underlying motivation. And where I want to start is with two concepts. The first is that over 5 million Canadians over the age of 15 meet the criteria for a mental illness. So a mental illness, a mental health condition, mental disorder is a clinically significant disturbance in someone's underlying emotional regulation, cognitive processes, or other psychological processes that is significantly impacting their day-to-day life. So what we know about mental illness and work is that adults who live with mental illness are often less likely to be employed compared to adults without one. We've been told this by decades and decades of literature from various jurisdictions around the world. But let's talk about what this looks like for Canadians who experience mental illnesses. So going to the research, when we talk about different mental illnesses in Canada, and when we describe the individuals experiencing them, one thing that's often reported is an employment rate. So how many Canadians with a given mental health condition are employed? Well, for Canadians living with substance use disorders, about 73% are reported to be employed. For those with major depressive disorder, it's about 68%. And for Canadians living with more severe mental disorders, like bipolar disorder, schizophrenia, or other psychoses, the proportion or percent employed drops down to about 10 to 30%. So these initial values or employment rates start to paint a picture of what things may look like for Canadians with mental illness. But myself and the investigative team think we can go a little further. And that's because an employment rate doesn't explain or provide information on how to improve the employment experiences of those with mental illness. We know that not everybody living with a mental illness is the same, so it's likely that individuals with mental illness aren't all going to participate in the labor force the same way. So when we were thinking about expanding this picture and describing it further, there were two types of questions that came to mind. Going beyond employment rates, our first questions that came to mind were questions about diversity and employment experience. So we were thinking things like, are employment rates for those with mental illness stable over time? In other words, for all working age Canadians who have major depressive disorder, is it that 68% are always employed and the rest are not? Or is there a little more nuance to it? And by nuance, we're talking about different experiences, or if it's not stable over time, how many different patterns are there? So is it more than just someone's employed or not employed? Could it be that people are employed for a specific amount of time, then are not, and then come back? Or is it more variable? The next question about diversity was how many employment patterns, how do they differ based on mental illness type? So in other words, are individuals living with bipolar disorder likely to have the same types of employment patterns as those with substance use disorders? And lastly, when it came to diversity, do these employment patterns or experiences differ among men and women with the same mental illness? Now, the second type of question that we were interested in were questions about comparison. So understanding the diversity in employment experience within a mental illness, between mental illnesses, and between gender is really important information. But we also wanted to contextualize it against a group that didn't have mental illness. So how do these employment patterns differ between individuals with and without mental illness? So these questions guided our two study objectives that we sought to answer. So our first objective was to identify the diverse employment experiences among Canadian men and women with a mental illness. The second objective was to compare these employment patterns to those found among men and women without a mental illness. So I've described our motivation for the study. I now want to either pull back the curtain or pull up the hood, depending on what metaphor you prefer, about the design and analytic methods that we used to be able to answer these objectives. We conducted a longitudinal cohort study where we had the opportunity to link national mental health survey data to annual administrative tax records. So I want to explain a little further about what our data looked like. For our data sources, the mental health survey data came in the form of the mental health focused Canadian community health surveys. Specifically, these were done in 2002 and 2012 by Statistics Canada, where they surveyed Canadians coast to coast to coast on the prevalence of mental health conditions as well as mental health behaviors in the general Canadian population. So for these two cycles of data, every participant, we were able to link to administrative tax records every single year from 1993 to 2017. Now, these annual administrative tax records came in the form of the tax income family file, which covers about 95% of the Canadian census population. When it came to measuring mental illness in our study, we measured 6 and we grouped them into 3 different disorder types. So the first disorder type were common mental disorders, which included major depressive episodes and anxiety disorders. The second type of mental illness we called severe mental disorders, which included bipolar disorder and schizophrenia and other psychoses. The third type of disorder group were substance use disorders, which was defined by alcohol dependence and illicit drug dependence. So again, these were measured in the mental health survey data, and most of them were measured with a survey tool called the World Mental Health Composite International Diagnostic Interview, or CD for short. So the survey tool asks participants questions similar to questions that would be used for clinical diagnoses of one of these disorders. The only exception was with schizophrenia and other psychoses, where participants were asked, have you ever been diagnosed by a healthcare provider with this condition? So using our data, we had to create a sample. So we applied 3 inclusion criteria to our data. The first was that participants had to be between the ages of 18 to 64 in their Canadian Community Health Survey cycle. The second criteria was that participants had to meet the criteria for one of those 6 mental illnesses in the year that they participated in the mental health survey data. In other words, if a participant was part of the 2002 data, they had to meet the criteria for depression, anxiety, substance use disorders in that 2002 year. And the last criteria was that participants had to have at least one valid measure of employment earnings. So after applying this criteria, we ended up having just over 1,200 men with common mental disorders in our sample, and just over 2,200 women with common mental disorders. For severe mental disorders, our sample included about 450 men and 540 women. And for our sample that met the criteria for substance use disorders, we included just over 1,200 men and about 560 women. So that created our sample for our first objective, but for our second objective, we had to create a no disorder group. And when thinking about what we wanted this group to be, of course, we didn't want them to have a mental illness, because again, we needed a comparison, but we also wanted to create a group that represented kind of peak health somebody could be in their working years. So the inclusion criteria we applied here, again, they had to be between the ages of 18 to 64 in their mental health survey data. They had to have at least one valid year of employment earnings in the tax records, but they could also not meet the lifetime criteria for a mental illness. They could not report having seen a mental health care professional in the past year. They could not report ever being hospitalized for a mental health issue, as well as they could not report having a disability or physical chronic condition that could impact their workability. So after applying all of these criteria, our no disorder group included just under 4,200 men just under 4,200 men, 4,150, and just under 3,900 women. So given that we wanted to build these employment trajectories or these employment patterns occurring over time, we needed to quantify employment status. And we did that every year a participant had valid data in the administrative tax files. And we based our employment variable on annual employment income. So in a given year, we defined a participant as employed if their employment income value was greater or equal to $5,000. And we defined a participant as not employed if their absolute value of their employment income was less than $5,000. So now I'm going to briefly walk through what our analytic method was to answer our objectives. So the first thing that we did was we stratified our data by gender and mental disorder type. So stratified men and women, and then the 4 types of disorder groups. Then among each of these strata, we used something called latent trajectory modeling to determine the number of different employment trajectories in each of these strata. So 2 little technical things I want to note here. is that we built these employment patterns or these employment trajectories from ages 18 to 64. And what we modeled was actually the probability of employment in a given year. So between 0 and 1. Once we had built these models for each of our strata, so again, men, women, each with one of our 4 disorder groups, we described the pattern in number of participants in each trajectory. That got us to the end of our first objective. And then for our second objective, we compared similarities and differences in the number and type of trajectories between each of the 3 disorder groups and the no disorder group. So let's put the hood of the methods car back down and get this car rolling to see what the results were. Where I'm going to start is describing the results that we saw for men. On your screen, you will see 4 graphs with various employment pattern lines. On the top, the graphs are for common mental disorders and severe mental disorders, showing the different employment trajectories or employment patterns. And on the bottom of your screen, you will see graphs for the different employment trajectories for those with substance use disorders and no mental disorders. So as you'll see, there's a lot of lines, a lot of patterns, and a lot of numbers. And I could be here all day talking about it, but what I want everyone in the audience to take away is our key message. And that is, for men, across these disorder groups, we saw 6 employment trajectories, and these trajectories were similar, again, across the different disorders, but the proportion of men in each trajectory varied by disorder. So now what I'm going to do is walk through the 6 types of trajectories that we found, describe them, and then describe how they looked in each of our 3 disorder groups, so the common, severe, and substance use disorder groups. So our first trajectory that we saw was a sustained employment trajectory. This was denoted by a high probability of employment all the way from ages 18 to 64. This trajectory was seen in each of these 3 mental disorder groups, and over 30% of men in each of these groups belong to this trajectory, with the highest proportion seen among substance use disorders. We saw there that 70% of men with a substance use disorder belonged to this specific employment pattern. The second trajectory that we saw was a delayed employment trajectory, and this was only seen among men with substance use disorders. So what this delayed employment trajectory looked like was an initial lower probability of employment in the early 20s, which increased to the levels of sustained employment in the prime earning years, so the 40s, late 30s, early 50s, and then decreased slightly towards age 64. The third trajectory that we saw was seen among men with common mental disorders and severe mental disorders, and this was an increasing employment trajectory. So this was denoted by a steady increase in employment probability from ages 18 to 64. The fourth trajectory type out of the 6 that we saw was an interrupted employment trajectory. So you can think of this trajectory as just a big U. Starting in the early 20s, we saw a high probability of employment, which decreased to the 40s and then started increasing again towards age 64. And this interrupted employment pattern was seen across all of the disorder types. The 5th type of trajectory that we saw was a premature employment exit trajectory. So what this type of trajectory looked like was an initial high probability of employment, which began to decrease after a certain age. And we saw 3 specific ages where this exit or decline in probability started. The first was around age 20, the second was around age 30, and the third was around age 50. So across the disorders, all exhibited a premature exit trajectory starting in the 20s or 30s. But for men with common mental disorders, we also saw a premature exit starting in the 50s. Now, the last disorder trajectory or pattern that we saw was a detached from employment trajectory. So on the graph that you're seeing here, I've pointed to what this would be with an arrow because we're starting to have a lot of lines on the graph. But essentially what this pattern was a very low probability of employment from ages 18 to 64. And this pattern was only seen among men with severe and substance use disorders. So that got us to the end of our first objective focusing on men. Now, when it came to our second objective, comparing these trajectories to the no disorder group, or kind of our fourth group, I've highlighted and put in a column showing the proportion of participants in this group in each of these different trajectories. Now, again, I could talk a lot about these different numbers, but there's one important thing I want the audience to take away today. And that's we saw a similar proportion of men in the no disorder group and the substance disorder group belonging to a sustained employment trajectory. So I've highlighted the graphs and highlighted the specific trajectory that I'm talking about. But here we saw in both of these two groups, over 70% of men had a high probability of employment from ages 18 to 64. And this was very different compared to what we saw in the common and severe mental disorders, where less than 50% of men in those disorder groups belonged to that specific trajectory. So to summarize, for men, we saw six types of employment patterns. The patterns were similar across the three disorder groups. And then when comparing to the no disorder group, men with substance use disorders seem to have similar patterns. So that's kind of a nice, clear-cut story of results. When it came to women, however, our results were more variable and it's a little more messy. So again, I'm going to start by describing showing the audience today what the different types of trajectories look like for women with common, severe, substance, and no mental disorders. So again, you're seeing a lot of lines, a lot of numbers, and a lot of different patterns. And that's kind of what the key message was. For women, we saw variability in the number and the types of trajectories identified. And across these four groups, we saw between 6 to 8 employment patterns. 8 patterns were seen for women with common and severe mental disorders, where 6 were seen for women with substance use disorders or no mental disorders. On this slide, I've highlighted a table showing the proportion or percentage of women among each of the different trajectories by disorder status. And again, a lot of numbers that I could be here talking all day about, but I'm going to highlight the 4 key takeaways that you should know today. The first takeaway related to women with substance use disorders. We saw that most women with substance use disorders were employed and belonged to that sustained employment trajectory pattern that we saw among men. So again, a high probability of employment from ages 18 to 64, and just under half of women with a substance use disorder belong to this trajectory pattern. And this differs from the other 3 groups that did not exhibit this trajectory. The second finding I would like to discuss relates to women with severe mental disorders. We saw for a fifth of women, or for 20%, they belonged to what we called a decline to partial employment trajectory. So what this looked like was initially a high probability of employment in the early 20s, which slowly declined until age 50 and then had a slightly steeper decline. Again, I'd like to highlight this because this is the largest proportion of women in any trajectory for women with severe mental disorders. The third finding is that we saw similarity between women with common mental disorders as well as no disorders. And that similarity was most women in these 2 disorder groups belonged to a premature exit beginning in the 50s trajectory. For women with common mental disorders, this was 29%, and for women with no disorders, this was 39%. And again, to remind everybody about what this trajectory looked like, this was an initial high probability of employment until the 50s, which then began to decline towards age 64. So the last finding that I would like to discuss relates to an interrupted attachment trajectory that we saw among women with common, severe, and no disorder. So common mental disorders, severe mental disorders, and no disorder. And that's that we found this unique interrupted trajectory, which we called the bump trajectory. So this was denoted by a decreasing probability of employment from ages 20 to 30, which then increased and remained stable for the remainder of the working years. So important to recognize that where this decrease and increase or the bump happens was between ages 20 to 40, which are the prime caregiving years. And we saw for common mental disorders, about 14% of women belong to this trajectory group. For severe mental disorders, it was about 17%, and for no mental disorders, it was about 10%. So I've thrown a lot of numbers, a lot of lines, and a lot of words at you today. I'd now like to summarize these findings and these results by filling our evidence gaps related to those questions about diversity and experience in comparison. So filling the evidence gaps about diversity and employment experience Canadians with mental illnesses are facing. The first question, are employment rates for those with mental illness stable over time? Our study is suggesting no. It actually shows that employment rates are dynamic, change, and they follow a number of different patterns. So given that it's not stable, how many different experiences or patterns are there? Well, our study suggests that there are 6 to 8 unique patterns that are seen across disorders in gender. When it comes to how do these patterns differ based on mental illness type, we saw that more individuals with common and severe mental disorders prematurely exited employment compared to those with substance use disorders. Or said another way, we saw that those with substance use disorders were more likely to be in that sustained employment trajectory. And lastly, when it came to diversity and experience, do employment patterns differ among men and women with these disorders? Well, for substance use disorders, we actually saw that the patterns were pretty similar among men and women, whereas for common mental disorders and severe mental disorders, women had more variability in their employment trajectories or their employment patterns. So moving to our question about comparison, do employment patterns differ for those with and without mental illness? Our study suggests yes. And that's compared to those without. Those with mental illness may have a higher likelihood of prematurely exiting employment. And that exit is occurring around ages 20, 30, and 50. So what our study set out to do was to illuminate what these experiences looked like beyond just a simple employment rate. And we feel like we did that. But there are some key limitations of our study that we should keep in mind and think about future research expanding upon. The first limitation is that the models and the patterns that we saw were based on current mental illness status assessed at one point in time. So whether somebody met the criteria in 2002 for a specific mental illness or in 2012. So this can't get to how potentially episodic patterns of mental illness might be impacting trajectories or how chronic courses of mental illness might be impacting trajectories. And this is definitely something that we want our future research to look at. Secondly, in our study, we defined employment as whether someone was employed in a given year or not. This doesn't get to, was somebody employed full-time or part-time? Were they employed in a precarious employment? How long have they been with a current employer? What industry are they in? And all of those aspects of employment are really important to paint the picture of what the employment experience looks like for Canadians with mental health conditions. And our third limitation is that this study could not explore the role of work context or mental health treatment in identifying how these factors might impact which people are in specific trajectories, or how these factors might improve some of the trajectories with less stable employment, which again is something that's a really important question to answer. I have 2 slides to wrap up today, and the first is a key message slide. So what I hope you take away from this presentation are these 4 things. First, having a mental illness did not mean that people could not be gainfully employed. We saw many, and most of our participants in our study were with a mental illness, were securely employed for at least 3 decades. So these individuals are working and they can work. Despite this, sustained employment was difficult for some, particularly for those with common mental disorders and severe mental disorders. We saw a premature exit occurring, so it wasn't the case that people were moving between being employed and unemployed. It was when you kind of start to leave, it's hard to get back. So this premature exit was happening, and it was happening around ages 20, 30, and 50. And the last key message is that we saw that the employment picture is varied for women with mental illness, and we suggest that research explores this more. And the last slide that I have prepared today is about placing this evidence into context. And what I want to start with is what this study can't tell us. This study can't tell us the key drivers of employment trajectories or what the most appropriate interventions are for mental health and employment. Again, our purpose was to identify what these patterns look like. But the study can still tell us really valuable information. And that's given that we saw multiple different employment patterns. When it comes to mental health and employment, it's more than a one size fits all experience. And this is something that we should think about in our not only our future research, but when we think about interventions. And when we think about interventions, what our study tells us is that these types of interventions probably should focus on two places: helping workers with mental illness not obtain employment, but also helping workers with mental illness sustain employment when they have it. And lastly, there are a lot of other great questions that we would have liked to ask, but for that, we need more robust Canadian mental health and work data to better understand these trends. So with that, I hope you've enjoyed the presentation today. I'm happy to answer any questions you may have now, or if you want to email me, my email is on the screen. Thank you very much.
Thank you, Kathleen. And thank you very much for making a really very complex set of trajectories and experiences much more understandable. We do have a number of questions, so we'll try to get through them, as many as we can. Please, if you have a question or a comment, type it into the Q&A box. And just a reminder, we will make the presentation available in about a week on our website. So let's get started. There were a couple of people who had asked about the reason for the $5,000 mark as defining employment. One person noted that sometimes people with disabilities are often the lowest income earners. So did that perhaps exclude people, some of the more severe cases of people with mental illness in your study? And another person wondered about the $5,000 mark and why not use something like a full-time income at minimum wage as an example of a comparison. Can you address those?
Yeah, and those are wonderful questions. So when it comes to research studies trying to define employment based on annual income, we typically want to capture people who are employed at a certain level where they're kind of continually working through the year or working for most of the year. So what we do on the back end of research is think about what are some of the different cutoffs that might distinguish someone who's a little more securely attached to the labor force versus not. So what we've done in previous research at the Institute is looked at just using a $0, using $1,000, a $5,000, a $10,000, and we find that that $5,000 is kind of the sweet spot there. So that's more of a methodological reason, but I totally hear what the people who've asked this question are saying about potential lower incomes and incomes related to disability that might be supplementing that. And for those people on the call, I'd like to say we hear you, and that's actually our next research question in the project, looking at different sources of income.
Okay, thank you. Also, some questions about things that you may or may not have been able to consider, and whether maybe some of these are topics for you in the future. So first of all, someone asks about the episodic nature of mental health. And I think you touched on this a little bit toward the end of your presentation. Has it been addressed as well as you would like? Can it be addressed in a more comprehensive way?
Again, a really great question. And I'd like to say to whoever asked that, that's a question that we think about on the investigative team all the time. So to start, my answer is, in this study, unfortunately, we couldn't address it. Again, it's just a starting point, and we wanted to go for, this is an employment rate, to these are what these experiences are looking like. Now, the next piece of the puzzle is to bring in how do different courses of mental illness, again, an episodic versus more chronic, how are they potentially impacting these patterns? I will say previous research that we've done at the Institute looking at working life expectancy among those with depression have shown that even just an episodic course can significantly impact people's work ability. So likely it's at play here, but definitely something we're keeping in mind for the rest of this project.
Okay, thank you. And I think you said the years for the data, but is COVID included in that? And can you look at the impact of COVID on mental health and employment rates? Will you be able to?
So in this data set, unfortunately, we weren't able to. So the administrative tax records went from 1993 to 2017. And when it comes to the COVID period and mental health and work, there's definitely a lot there, just something that we can't address in this current study, just some data limitations.
Do you know, will there be data available that's post-COVID in the future?
I think in the future there will be.
Okay, thank you. Were you able to look at, I don't know if these data sets have issues like rural, urban locations for where participants are living or available and accessible supports in various regions? Can you include that in some, I know you haven't in this study, but in some work?
Again, this study was focused on just what are the patterns. The next thing the investigative team is doing is looking at, well, what are some of the predictors of the patterns or correlates of these patterns? So we've started to look at that. It isn't necessarily as significant as someone may think, but it's a great question to think of, especially we know rurality versus living in an urban center can both greatly impact employment and mental health. So again, to the person asking the question, we're asking the same one and thinking about it as well.
Okay, thank you. Turning to some of your data, someone has commented that it looked to them like childbearing years impacted women's employment trajectories, especially among the common mental disorders and severe mental disorders group. Is that your take on the findings? Can you comment on women and what's happening there?
So again, I'd like to remind everybody, all this study can do is just show what the patterns are. Now, when it comes to hypotheses, this is where myself and the research team are starting to think about what they may be. And so definitely the childbearing years, when we first saw that, that's where our mind went to. However, the picture may be a little more complex. We don't know if that kind of bump is because women are choosing to exit employment for a period because of childbearing or raising their families, or if they're kind of being pushed out, or it's kind of a frozen exit, as we say. So it's definitely something that we're going to be researching more. So stay tuned.
Okay, thank you. Someone has commented, often my stakeholders like numbers. How much more likely is a man or a woman to have early employment exit due to, for example, common mental health disorders versus someone who does not have a common mental health disorder, like an odds ratio? Is that something that you have available?
Right now, with this study, no. However, what I would tell that person is the big number to take away, I think, is especially for men, that difference in sustained employment. So we saw 72% of men without a disorder were in that sustained employment group. When it came to our different mental disorders, it was 70% for men with substance use disorders, 47% for men with severe mental disorders, and 38% for men with common mental disorders. So those would be the numbers I'd focus on. And if you want to make some odds ratios out of that when the slides are posted, be my guest.
Okay, thank you. Um, Can you address the no disorders trajectories that seem to sometimes show surprising findings? In some cases, it looked like people with mental health conditions had more positive outcomes. Can you comment on that?
Again, when it comes to employment trajectories or how participants participate in the labor force, it can be a very varied experience. And one thing I think we should take away from these findings is just because someone follows a trajectory doesn't mean that it's bad or good. So, for example, somebody might be detached from the labor force with no disorder, because they don't have to work. They might come from a family with wealth compared to somebody else who may not. And the reasons why they're detached from employment may be very different and kind of on the negative spectrum. So right now I would caution against one saying better or worse. They're just different. And this is somewhere where our research, and again, we want to go into, well, what is better or worse? What is it that someone's choosing not to fully participate versus they're being forced not to participate?
Okay, thank you. Someone is interested in sampling, and is it possible that people with the most severe disorders and substance use problems are less likely to participate in surveys and are therefore more likely to be excluded from the study? Do you know, are there any ways to account for that, assuming that it is even something that's going on?
Yeah, so there is a possibility that it's going on. And if it's there, likely what we've seen, or likely what would happen if we were to include those individuals, is it may be more difficult for them to be employed, because many employers, it's a very hard line. You can't come to work impaired. But what I will say, and get a little into the sampling weeds, but not too far in the meadow, is that the Canadian Community Health Survey is done by Statistics Canada, and they use a sampling frame that covers 97% of the Canadian population. So the people that aren't included are Canadians in the armed forces, Canadians living in institutions or group homes, Canadians who are homeless, and a few select rural regions in Canada, as well as individuals living on reserves. So it could be that more people in those groups um, may be more likely to have substance use disorders. But in terms of the study, we think the bias there likely is minimal, but it's definitely something that we've thought about.
Okay, thank you. Someone is wondering if you are aware of estimates for undiagnosed mental illness in the population. If there are large numbers of people who don't think they have a mental diagnosis or haven't been diagnosed, and whether or not that might have impacted your non-mental illness group findings.
Yeah, so definitely it could have. And there's two ways that I'm going to answer this question. The first way is, again, when we talk about mental health, there's a lot of different ways that we can define it. And other research that we've done at the Institute has tried to take a more holistic view, looking at both mental illness and positive mental health. But in this study, we specifically focused on mental illnesses. So we acknowledge there might be a group that we're missing. Now, the second way that I'm going to answer this question is, of course, with surveys and people reporting, there might be some measurement bias there. But again, many of the questions asked about these disorders asked about symptoms rather, do you have a diagnosis or not? That was only for schizophrenia. But even if there was some bias there, that's why we also included the criteria they couldn't have talked to a mental health care professional or ever been hospitalized for a mental health condition.
Okay, thank you. By the way, lots of comments, a great presentation, so lots of nice comments coming in. One of the listeners is interested in what you think might be the most critical additional data sets, health or economic, to link to that might enable some of your next research steps. And do you know if any of these linkages exist or are planned?
Oh my gosh, I love that question. Um, I don't know of any linkages potentially planned. In Canada, building mental health surveillance is something that has been a gap for a long time. And although we do our best, there's definitely places to improve. But I'm going to answer this. What is my ideal data set to further this research? And that's, we really need to have data that links not only mental health data about an individual, but also healthcare system data. So how are they participating in the healthcare system and what support are they getting there? But also what's happening in workplaces, because we know, one, mental health doesn't occur in a silo, and to think about policies and interventions about improving mental health, there's multiple players involved. So if we can get a data set on what those multiple players are doing, then we can start to research what are potentially the best solutions.
Okay. Um, Someone is asking, are you the first to identify these trajectories, or have they shown up in other people's research?
We're the first in Canada to identify these. There has been some research that has occurred in Scandinavian countries as well as other jurisdictions around the world. But what I'd say to that, the body of research that exists on these patterns is it's very few and far between, and very few studies have done what we've done, where we've looked from ages 18 to 64. So we really show a whole working life course view of what these patterns look like. So it's definitely a really significant impact to the literature.
Okay, great. I'm going to read this out. To me, one of the most interesting findings in this study is that those who fit the criteria for a substance use disorder had almost the same likelihood of sustained employment as those with no mental disorder. Given that one of the criteria for SUD diagnosis is an impact on social and occupational function, it raises questions about the integrity of existing diagnostic criteria. What are your comments?
That is a big and important question. And I'm going to answer this in two ways. The first is I'm not a clinician. I'm not a mental health care professional. So when it comes to diagnostic criteria, that isn't necessarily my area of expertise, but it's probably something that should be discussed. However, in the context of what the literature says about similar patterns seen among those with substance use disorders and no disorders, it's actually been a finding that has come up in a few studies. So initially, when we saw the results, we were a little surprised, like, oh, they look very similar. But when we went to the literature, we saw that it's a finding that's been seen before.
Okay. Thank you. Were individuals with PTSI included in the study? And if so, where would they have been, under CMD or the SMD category?
So individuals with PTSI, we didn't assess it in the study. So it could potentially be that individuals with any types of the disorders could also be experiencing PTSI. But what I'd like to remind the audience is that this mental health survey data is a general population survey. So the rates of PTSI are very, very low, and they're likely not reflective of some of the industries where we know PTSI to be very high, like in first responders. So we think it's an important question to ask and answer about what the different employment patterns are among that population, but this might not be the data set to look at that with.
Okay, thank you. A number of questions about different other variables that might be included in future research, and just wondering if you can comment on to what extent some of these variables might be available now, or you think they might be available in other data sets. So I'm going to try to just combine a number of issues that people have raised as very interesting to them. So one of the listeners is very interested in whether you had access to occupation, industry or industry attributes in your data source, and whether you could look at industry type or occupation in these data. Could the data be explored to look at other social indicators like family history, family size, supports and household income? And someone else who is wondering about the ability whether to look at the data in terms of race, gender, and sexuality. And so I know I've thrown a lot at you, but I can repeat any of those kinds of variables. What have we got that would allow us to look at some of those variables, and what kinds of questions are we not asking in these surveys?
Thank you everyone who asked about these individual factors. I'm going to go one at a time, and I wrote them down, so I think I got them. The first relates to industry and occupation. So in our data, we do have a measure of it. Unfortunately, that measure is very broad. So it's something that we could look at. Will we get the most optimal and nuanced findings from it? We're not very sure. So this is definitely a place where if we were to supplement or collect data, we'd want data collected. The second group were related to family history, family support, and family income. We do have those variables in our data set, and we have a lot of, it's interesting, in Canada, not a lot of our data sets, when it comes to mental health, that are linked with kind of economic outcomes ask about family history. So that's definitely a strength of this data set. And we do have some indicators of family size as well as family income. Now, the third bucket of variables, race, gender, and sexuality. Unfortunately, given when these mental health surveys occurred, sexuality wasn't measured. Although in more recent data, we know that it is. So it does exist. It might just take a little bit of time to get it. In gender, while we can look at some gendered factors, given our sample size constraints, although we're working with a big data set, when we start to cut it down, it gets quite difficult. So something the research team is interested in is going beyond just man and woman, but to someone's family type. So are they a woman who's married with kids, a single woman, single man, a man married with kids? We know labor force participation and mental health can differ based on those factors. And in terms of race, we do have variables about that, but this is definitely a place in Canada where, again, if we were to put more money to get more data, is a place that we need.
Okay, thank you. Throwing a lot of questions at you. We still have a few more. We'll try and get through a couple more before the end of the talk. Someone commented that whether a person leaves the labor force, who leaves the labor force in their 50s is doing so prematurely will differ from case to case. Women without mental illness, for example, may be retiring early because they have the financial means to do so. Could further research examine whether people leaving employment, like women with and without mental illness, experience a significant decline in overall income, for example, as a way to try to understand whether this is a choice or whether or not there are some other reason that's maybe forcing you out of the labor market?
Yes. And my answer is yes. Again, with this research, we've identified the trends, but we don't know what's underlying them. So, for example, that exit around 50, is it that somebody's exiting for early retirement because they're like, I've done my work, I've made my money, I'm ready to go? Or is it I can't manage my health and my work, so I can't work anymore? So thinking about those as a chosen versus kind of a frozen exit. So this is something that we find definitely important to research because it's a place that we can hopefully support people staying in work if that's what they choose.
Okay, thank you. You mentioned military personnel before not being in some of these surveys. There is the Canadian Veteran Health Survey, the CVHS. Are you familiar with that survey? Is that something that you would possibly be able to get access to look at some of your research questions?
Yeah, so I am aware that it exists. In terms of its linkage with administrative tax records, I'm less clear on that, but definitely something for us to look into. And I'd like to thank whoever brought up that suggestion.
Okay. The results for substance use disorder are very interesting. Do you have a sense of whether when people are talking about substance use, given the time that the data were collected, that they're talking mostly about alcohol or versus drug disorders? What do we know that could maybe unpack those findings a little bit more?
Yeah, so when it came to being in the substance disorder group, people could fall in one of three camps. They could just have an alcohol dependence, they could have illicit drug dependence, or they could have both. We found that most people in the sample reported having alcohol dependence, with kind of the next biggest category, and that was most of the participants, followed by illicit drug dependence, and then followed by both. So it would be safe to say that, again, individuals in these trajectories, when we looked at who was falling in those three buckets of substance use disorders, we saw all three in all three different types. But it's definitely a great question for us to unpack in the future, especially given that we've had changes in our cannabis legislation, and the way that we talk about it has changed since 2002 and 2012.
Thank you. When you've got the sustained employment, that just tells you they're working. Does it tell you whether or not they've changed jobs? Is there a variable that looks at people who might be moving to different types of jobs, but they're remaining employed?
Unfortunately, in our data, we don't have access to that. And we wish we could have access to that because, again, we know that an employment experience is more than being employed or not being employed, or even being in one of these kind of 6 to 8 trajectories we found. It's how are people moving from job to job, or is it people are staying in one place? So unfortunately, we have a gap in our data here in Canada. But again, if we had money to fix it, we would be doing that at the Institute and asking those questions.
Okay, thank you. Are people who are self-employed included in the data?
So people who are self-employed are included in this data, which is great because sometimes in economic research like this, they're excluded. Unfortunately, we haven't gone beyond that to understand how exactly they're moving around, but something we'd like to do in the future.
Okay. Someone would like to have you just put back up your slides, that the last slide about the 4 key outcomes, the key
Okay.
messages. Can you just speak a little bit, in a minute or so, as we wrap up, a little bit more about these key outcomes?
My 1 minute takeaway is, again, this study, although descriptive, it's complex and there's a lot moving around and there's a lot we can take from it. But I think remembering that most individuals with mental illness we saw were working and were attached to employment for generally 3 or more decades is an important message, because sometimes, unfortunately, the narrative can be these individuals can't work. But if they want to, we see that they are working. However, despite this, being sustainedly employed was difficult for some, particularly those with common and severe mental disorders. And what we saw was when people start to exit or start to have a lower probability of employment, it's hard for it to get back up. And lastly, the employment picture, when we painted it for men, was pretty clear. Again, a nice story, 6 trajectories, similar. Men with no disorder and substance use disorder looked similar. But for women, the picture was more varied, and this is something that we want to research more. So hopefully that's my good 1 minute summary.
Okay, thanks so much. And I want to thank everyone for joining. That's all the questions we have time for today. Again, lots of compliments coming in, Kathleen. People have said that they will share your data with others and appreciate the evidence. Hope that you will find some more patterns of interest in the future that you can share with us related to mental health. I do want to, again, thank all of you for attending, let you know that the presentation will be posted so that you can get access to the data, and invite you to be back and join us in about a month on October 21st. We will have Dr. Avi Biswas presenting, and he will be talking about engaging employees in wellness, insights from workplace champions. So thank you, everyone. I hope you have a terrific day, and thank you, Kathleen. It was really terrific. Appreciate it.
Well, thank you very much, everyone.
Bye-bye.